for you, but it's not cancer.
It's not life-threatening,
No.
thank goodness.
Yeah.
Although not malignant, Adrian is still desperate to find out why it's forcing him to go to the loo so often.
So here we see your pelvis again, Adrian, and what we've done this time, we've got the bladder on the top and also the prostate gland, and we've cut through the front of the bladder and the front of the prostate as well. And what you can see is that the prostate gland is bulging up into the base of the bladder. This is a very sensitive part. So if your prostate gland is pushing up and stretching this area, it's essentially giving you the urge to go more often.
How much volume has my prostate reduced my bladder by?
Well, that's difficult to gauge, but it's probably reducing it by 20 to 30 cubic centimetres.
Why is it that sometimes Adrian either has just a few drips or can't go to the loo at all?
Well, let's take a look.
Okay.
A normal subject, we can see the urethra, the tube that carries urine from the bladder through the prostate gland to the penis. On the other side, we can see Adrian's, but it's much narrower than it is in the normal patient, which we see over here. And that narrowing is like the kink of a garden hose, reducing the flow of the water.
Oh, Adrian, I mean, what do you think when you see that so visually?
I'm horrified. I'm alarmed. There's almost a sense of urgency now. Seeing the volume of it, thinking, God, I've got to have something done with it.
Fortunately, Nick has a particular treatment in mind.
So the procedure we're going to do is prostate artery embolization. What embolization means is blocking off an artery and taking away the blood supply to the target organ.
So you're starving it?
Exactly, that's right. That's what causes it to shrink.
As Adrian's prostate shrinks, it should relieve the pressure on the bladder and open up that narrowing in the urethra, allowing urine to flow freely once again.
How are you going to get in, and what are you going to do?
Okay.
I need reassurance on that.
Yeah.
Adrian, you come and stand here.
I bet you do. I bet you do.
So to do the procedure, we get a really tiny tube, less than 1 millimetre in diameter, called a microcatheter, and under X-ray guidance, we're going to find a way up into the main artery, into the pelvis, and then into the prostate artery to this point here.
Yeah. Why that bit there?
So that's the very beginning of the prostate artery.
Yeah.
Once the catheter is in position, Nick will inject tiny plastic beads down both branches of the artery that feed the prostate until they reach a point where they are too big to pass through and block it up.
Will there be a point where the prostate stops shrinking?
Yes, what we're hoping for is at least a 25% reduction in the gland, and the most we've seen is a 60% reduction.
Okay. Can I have a pint?
Big question.
Because we're reducing the outflow obstruction, the bladder won't cause the same kind of urgency and desire to go and so on. Yeah.
So I maybe should start on a half first then.
Maybe, yeah. Just maybe a shandy, yeah.
Adrian may be hoping that surgery will liberate him from the loo, but on average, we Brits spend almost 30 minutes on the toilet every day. But all these trips can be bad for your health. Here
are some mistakes that you probably didn't realize you were making in the bathroom, and it might improve your health. Sitting on the throne for too long is not recommended. When you sit this can result in hemorrhoids, which can cause pain, itching, and bleeding. Not fun. It's important to avoid straining all the time when you're in the toilet. This can weaken the pelvic floor muscles, which over time can lead to conditions like pelvic organ prolapse and even urinary incontinence. Also, the flush can actually cause a tsunami of microscopic poo particles and bacteria to float around and settle on various things you don't want it to settle on. Your towel, or even worse, your toothbrush.
In our virus that just 7 weeks ago put her in a high dependency unit.
It looks so angry.
Still suffering with the effects of fatigue, she is hoping Dr. Goody and Dr. Wong can help her understand what it is that's had her fearing for her life.
And what were you feeling? Just tell me what it was like.
I don't think in my 71 years I have ever felt such terror. Being wheeled into the room that said high risk and intensive care and all the rest of it, I just thought, I'm not coming out of here again. I just kept saying, I don't want to die here, my family needs me, which was quite, it was very scary.
Rosie spent 11 days alone in hospital with COVID-19. But in her darkest hours, there was one thing that kept her fighting.
My phone was attached to the wall with a bright yellow cord, and I felt like it was... utterly dire. We have a song that we sing when the Sabbath comes in, and each family took one verse. I can't do this.
Okay.
Oh, here they are. Here they are. Each family took one verse of this song, and they sat together as a group, and they filmed the... to give a hug. I love you so much too.
The big image and the big picture. And the reason why you were so breathless, to understand that, is a microscopic issue.
At the end of our airways, there are more than 300 million microscopic air sacs. Individually, they're far too small to be seen on an MRI or CT scan. But the doctors have created their best estimate of what they look like in Rosie's case.
Oh, amazing.
Rosie, we're looking at the alveoli here, the little air sacs right at the end of the smallest airways. And that's where the oxygen exchange takes place.
So they're like little balloons.
Look, this one shows it here. If you look at it, it's like a little balloon, it's like a little sac, and it's hollow inside. So that's where the air actually comes into it.
These are cut off.
Yeah, exactly, so you can have a look.
As we breathe in, the air sacs fill with air, and the blood vessels surrounding them collect the oxygen to feed our body.
This is all scaled up to about 1,000 times of what it should be. So we're really looking at tiny, tiny, tiny things.
And of course, the sacs are there to create more surface area.
You've got a lot of medical knowledge.
Well, I've had a bit of a crash course last couple of years, to be fair.